How should you sleep in pregnancy? Well, you don't need to sleep in a particular way for the whole 9 months. Until 20 or 24 weeks, like till 6 months, you can just sleep the way you like to sleep. Just don't sleep on your tummy because that will just put pressure. It's just going to be uncomfortable. So you can sleep right, left, back, however you like till say 26 weeks. After that, you need to sleep on your side, any side, right side or left side. Because your uterus is like a very big, it's a growing organ, it's like a big ball. So what it does is, if you're sleeping on your back, it's going to press on all the big blood vessels, the aorta and vena cava. They're like in your lower spine. It's going to press on that, and there's going to be like a little less blood going to the baby. And also, when you're like suddenly getting up from that position, you will feel dizzy because suddenly the blood supply to the brain is reduced. So from 28 weeks, 26, 28 weeks onwards, try to sleep on your sides as much as possible. Just see to it that you're not on your back. So you don't literally have to be on one side completely. What you can do is, you can just like cushion a pillow, like you can just cushion your back a little bit on this side so that it's little bit tilted, So suppose if this is how you're sleeping at night, this is your back, okay? So you don't need to sleep like this, as in fully on one side. You can sleep a little like this. So you see, like you can be a little tilted. That is also enough. Little lateral tilt, we say. So it can be on the right side, on the left side. You can sleep on any lateral side. So not necessarily full on this because it can really hurt, but little bit tilted so that your that midline should not be under compression with the uterus. There were some people who would say that keep your legs up and sleep. So certain conditions in pregnancy, especially if you're like if your cervix has opened up and your bag of membranes are like bulging, like preterm labor if it's happening. So previously what we used to do, we used to tell the patient to be in the bed. We'll raise the legs up and make her sleep like that. But we no longer do that as such. Like you can be on complete bed rest. Like the idea is like you just go to the washroom and come back. That's if your cervix is open and your bag of membranes is bulging out. That's the only time when we will put you in bed rest. But would you have to be upright, like with your legs up? Not necessarily. As long as you're just resting, that's good enough. Now remember, whenever you are on such a long bed rest, we highly recommend you take a blood thinner, because when you are completely bedridden for so long, there are chances of having blood clots in your legs, purely because you're pregnant and also you're on complete bed rest. So this blood clot can go to your lungs and brain and can be life-threatening or can cause paralysis. So that's why in today's day and age, most patients who are on complete bed rest are given a daily blood thinner, which is an injection in your thigh or arm, wherever. It's a subcutaneous injection. Now, this sort of bed rest can be very handicap-like. So in the beginning, it might really mess up your mind. But remember, it's always the baby and baby's well-being will be your motivating reason to stay in that. So don't be scared. But if you have just little bleeding and your cervix is closed, you don't need that kind of bed rest. Also, as your pregnancy grows, it's going to be very uncomfortable to sleep overall at night. You can't just get up from like this, now you're sleeping like this and you can just like get up like this, right? Because your abdominal muscles are like very, very strong. But as your pregnancy grows, your abdominal muscles like literally split apart and they just don't work. Like you can't just do this, even if unless you're very well toned, but no. So you'll have to use your other muscles to get up, because that's how they will help you come up, and that's nothing is wrong with that. Last but not the least, sometimes you have blocked noses. Some people have deviated septums and stuff, and then the pregnancy produces blocked nose throughout 9 months. So if you are someone who has that sort of thing, you might figure out to sleep in one particular position and stay in that position. That because you will be by default in that position because that's where you can breathe better. So these are the ways you can sleep at night. Also, I would recommend don't drink too much water before going to bed, because then otherwise you will want to wake up multiple times to pee. Apart from that, I think that's it. If you have any more queries, please bring it to the call.